Hi, everyone. Thanks for joining me. I'm going to be doing a demo of an IV insertion. So before we get started, just want to talk a little bit about the location of where you'll insert an IV and also the type of IV that you'll need. So it all just depends on why your patient is here and what they're going to need. For example, if a patient comes into the ER, they need to do a CT scan, or maybe they're going to need blood or a large volume of fluids, you're going to need to go for a big vein, and you're going to need a large gauge needle, such as an 18. And on another note, let's say a patient is coming in for a procedure and is going to be in the hospital for a couple days. You don't want to go for the vein in the crook of the arm because their IV pump is going to beep all the time, and you're not going to need an 18 gauge. You're going to need something more of like a 20 or a 22. And then there's lots of other situations in between, but I think you kind of get the gist of every patient's a little different, and the reason why they're there, it all depends on those factors. And so you'll need to use the correct gauge according to those situations. For our situation today, we have a patient who's coming in for a procedure. He's going to be in the hospital for about 2 nights. He's going to have IV antibiotics. And so I'm going to go for 22 gauge IV catheter. And so let's go over the supplies that you will need. So of course, as I mentioned, you're going to need the appropriate IV catheter. I usually like to take in 2 into the room with me because my motto is you get 2 tries and then you get another nurse to try after that, because sometimes it's just not your day. You're going to need some alcohol preps, an extension set, an IV flush, saline flush, and your tourniquet. Depending on where you work, some of these supplies come in a nice, convenient package, but just know that that's the gist of what you're going to need. All right, now the fun part, looking for a vein. I'm gonna wash my hands. And I'm gonna get my gloves on. Make sure you get some nicely fitting gloves. Sometimes I see people putting on mediums when really they're small. So make sure they're nice and snug. All right, finding a vein. So you need to put this tourniquet on tight. And this also depends on your patient. Some patients have such nice veins, you hardly even need a tourniquet. So you don't really need to put it that tight. Some people have really deep veins and you really need to put it snug so that you can get those veins to pop. There's other ways that you can get those veins to pop, such as having the patient dangle their hand down for a couple minutes. You can use warm packs. Those are just a couple of examples. But practice this at home. If you can get your hands on a tourniquet, practice looking for veins. Some hospitals do have vein finders. I personally am used to going by feel. So if you have a vein finder, that's a great resource, but I don't like to rely on that. Sometimes they don't always work. So basically here we are, we got the tourniquet on. I'm gonna be able to I wanna be able to close my eyes and feel that nice plump, bouncy feeling of the vein, okay? I should be able to feel it. Sometimes you can really see them pop up. Others are a little bit deeper and you really need to, or they have a lot of hair or a lot of freckles or they have dark skin, and can't really see it. So you really need to look around and feel. And I found a really nice one right here, okay? So I'm gonna make a note of where that is. I'm gonna undo my tourniquet for now while I get all of my supplies ready. I don't wanna leave that tourniquet on too long because I don't wanna risk blowing the vein. All right, here we go. I'm gonna open up my IV catheter. Have that ready to go right here. I want to have everything open and ready to go with just one hand, because once I get that IV in, I'm going to be holding the IV here, and I'm only going to have one hand to reach for these supplies. Put my alcohol swabs, my extension set, which I'm going to attach to my saline. That bubble out. I'm going to attach it just like so. And I'm going to prime, this tubing is filled with air, so you need to get out all that air by flushing it with a little saline. I'm also going to loosen this cap and make it so that I can flick this off with my thumb when I'm ready to use it. I'll put this right here within reach. Okay, now I am ready to put my tourniquet on again. All right, I see where I'm going to go. And then I'm going to really scrub the skin using friction. And the nice thing about using the friction is that this will cause the veins to pop up a little bit more too. Then I'm going to give that a chance to dry. All right. Definitely want to give it a chance to dry, because if that alcohol is wet and I insert my IV, it's going to sting a lot more for the patient. All right, here we go. I'm going to make sure my bevel is up. You're going to work with many different types of IVs. This one in particular has this little white button here. That is going to engage the safety of my needle. And as you can see, there's the IV there's the catheter. It comes off of the needle. So the whole purpose of the needle is to break the skin and get the catheter into the vein. I think that's a common misunderstanding for patients, is that they think that there's a needle in their skin or in their arm, when in fact, it's just a little plastic straw. Okay, so here we go. As mentioned, every patient's a little bit different. Some people have a lot of extra skin, but for any patient, I'm going to want to anchor this vein and anchor the skin down so that my vein does not move on me. Here we go. We're going to want to go at a pretty low angle. Once again, depending on your patient, how far this vein's popping up. If it's a deep vein, you need to go in a little deeper. But I'm going to do my initial poke here. I try to give my patients a little warning. 1, 2, 3, poke. All right, my needle is in. I'm going to drop my angle, insert slightly, not too far. Now I'm at the point where my needle does not need to go any farther. I see the blood in the chamber. I'm in the vein. If I insert my needle any further, I could go through the vein and blow the whole thing. At this point, I can undo the tourniquet so I don't blow my vein. Now, the only thing, now this is the tricky part. I'm going to push forward the catheter using this little blue part here, the hub. Pushing the hub forward advances the catheter and not the needle. Now I am ready to hit that little white button I mentioned before and engage the safety of my needle, because I don't need it anymore. But before I do that, I need to put pressure just slightly above the hub so that I don't have a big bloody mess. So I'm holding pressure right above the hub. I am going to press the white button. Now my needle is safely in there. And see how by holding pressure, I'm stopping the blood from pouring out of the hub. I'm holding pressure, I'm securing the hub, and now I'm attaching my extension. making sure to attach it tightly. You don't want this to come loose. All right, now I'm not out of the woods yet. Until I secured my hub and my tubing with tape, this thing could easily fall out. So I am not gonna let this go or let this move, but I am gonna check for blood return, and I am gonna flush and make sure that I don't see any, that I don't see the skin swelling up. I'm gonna ask the patient how they're doing. Oh, they feel fine. Everything looks good. I'm going to secure everything here with my tape. All right, I can breathe a little easier now that my tape is securing my hub. I'm gonna remove this paper here. Now, normally I would actually have some additional pieces of strong tape to hold the hub in place. Usually your IV kits will have those. I'm going to lock my extension tubing so that the blood doesn't backflow. I can remove my saline flush, and I would tape things very nice and neatly, just like that. And that's about it. One thing I do want to mention is that inserting an IV can be a very stressful skill for students because it's stressful for the patient, it's painful, and a lot of the times they've had really bad experiences. But you know what? I think my #1 recommendation is just get out there and try. You're gonna be nervous, and you just have to fake it till you make it. Fake that you're confident. Think that you've done this a million times, and your patient will feel more comfortable knowing that you're at least exuding some confidence. But also just remember that whether or not you're good at inserting IVs does not determine whether or not you're a good nurse. So I just want to make that clear. There's plenty of nurses who call upon their colleagues who are better at inserting IVs. But I am positive that you will just get better over time. I just hate to see students get so stressed out about the skill. It just takes time and practice. You can practice as much as you want on these arms, but really you need to just buck up and get out there when you're in the clinical setting. Ask the nurses if they have any IV opportunities for you and take those opportunities. I'm available if you have any questions. You can email me, jfritz@miracosta.edu. I hope this was helpful and have a great day.